Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a really simple technique to help stretch out an important ligament in the shoulder that has the potential to irritate several different structures right within the shoulder joint. But before I continue, please hit that subscribe button below so you can be notified about any new videos that I put up in my channel here. So there's a really important ligament in through the shoulder called the coracoacromial ligament, and essentially this ligament, it attaches onto two bones on the shoulder blade region, okay? And this ligament contains several different structures within the shoulder joint. So there's a bursa in this particular region. We have, or just below this region, there's several different, they're called rotator cuff muscles within this area. And so what can happen is that this particular ligament that I discussed, when it contains these things and we bring our arms into different angles and positions, right, we can get some sensitivity within these because of these structures. And so when there's a lack of flexibility within this ligament, there's a greater likelihood, right, of one of these structures potentially getting inflamed, irritated, causing pain. And so there's actually a doctor, Dr. Kirsch, I believe, who did studies showing that you could actually increase the space within this particular area of the shoulder by stretching this ligament, that there was a way to actually stretch this through simply hanging on something, right? So basically raising up the arms and holding on and actually almost doing like a little bit of traction in through the shoulder, which will actually increase, again, the space within this subacromial area and can actually lengthen to some degree, right, this ligament. And so again, he's had several different case studies, so to speak, on helping patients with this impingement syndrome. So again, if you have an opportunity potentially to hold on to something, right, whether that's, you know, as when you're a kid and you're holding on to on the playground, right, to bars basically, and just hanging your body there, that's actually quite good for the shoulder based on these studies. If that's not available to you, right, simply raising up the arms prior to going into any sort of pain can actually help to, again, stretch out this ligament and help to increase this space and ideally reduce the sensitivity on these particular structures within the shoulder joint. So essentially it's just as simple as doing a quick little look up. This will essentially increase the extension through your mid-back and your neck area, right? So a little bit of a look up, and then basically hands or palms together in this manner in a parallel fashion, raising up the arms and holding there, right? Now, again, we don't want to go into any sort of pain. So if you're struggling, right, with some kind of shoulder issue at the moment, and you've got a limitation within how far you can actually flex your arm, well, you're not going to want to go into pain, but you'd want to go to the point just before pain, right, and then hold it to, again, this could be like 5 to 10 seconds in an area that you can tolerate. So again, I want to emphasize, we don't want to go into any sort of pain with this, but it has been shown that this sort of sustained flex position can stretch out this particular ligament and increase that space. So over time, right, the sensitivity within these structures should improve. And this can also be a great preventative way, right, to prevent any sort of onset of sensitivity within the shoulder, right? So essentially, again, I'm looking up, I'm extending out, and I'm holding, right? And again, if you have access to something in which you can actually, you know, grip on and let the body hang, again, from a research standpoint, this has been shown to be beneficial. Please feel free to leave a comment below if you have any questions or concerns, and also please make sure to talk to a doctor or physiotherapist to make sure that this and any other exercises are right for you and whatever condition that you might be dealing with. Thanks again for watching, and have a great day. Take care. Thanks. Bye.